Shift some gears here and look into something or matters health. And in this case, we're talking about diabetes. Now, the prevalence of diabetes continues to soar, and this is accounting for 20% of deaths in this country. Now, let's just look at some of the facts here. 1 in every 17 Kenyans is said to have diabetes. That is a huge number in this population. Another fact that you need to keep in mind is that about 90% of people with diabetes have type 2 diabetes, which is said to be preventable. And another fact about diabetes I'd like you to keep in mind is that poorly managed diabetes can lead to complications like cardiovascular disease, blindness, kidney failure, and lower limb amputation. Very critical to keep that in mind, even as we look at why these numbers keep going up and up. But today, we're looking at something else that has come up, and we're talking about diabetes reversal. Many have heard of this, some are being skeptical about it, but we'll be hearing about more of this and the results of the same. And to guide us in that conversation, I have Isaac Masharia, who is a post-diabetes patient. Thank you for your time. And Dr. Daniel Katambo, who is a physician. Thank you, gentlemen. Now, I'll start off with the definition of diabetes mellitus for us who do not know, is that it is a chronic disease in which your blood glucose or blood sugar levels are too high. This could be an indication that your body is either not producing insulin to break down the glucose or is not using the insulin produced well enough. Operative term here, chronic condition. So how is it that we can reverse it, Dr. Ari?
Yes, thank you, Gladys, for having me today. It's true. For a long time, more than 50 to 100 years, we've known especially type 2 diabetes to be a chronic progressive disease. But right now, with current research, and especially for the last 10 years, we have scientific evidence that actually type 2 diabetes can be reversed using the appropriate measures, especially if you focus on lifestyle change.
Okay, and we'll break those down, but there are 3 common types of diabetes, type 1, 2, and gestational diabetes. Are we saying we can actually reverse all 3?
No, we actually say we can only reverse type 2 diabetes. And remember, when you say gestational diabetes, sometimes it can actually disappear by its own soon after delivery. But some people are prone to progress to type 2 diabetes soon after, even after the diagnosis of gestational diabetes. So in that case, again, we can also, with good measures, we can also be able to reverse such conditions.
Okay, so let's bring in Isaac. You are a post-diabetic patient. Yes. Now, type 2 diabetes, right?
Yes.
How long did you live with it?
For around 7 years now.
7 years.
Yeah.
So when we say you're a post-patient, exactly where are you at? Are we saying you're no longer using medication? Are we saying that the medication has decreased? What exactly?
Oh, it starts with the decreasing medicine. But for now, I don't use any medicine.
You don't use any medicine?
None.
No insulin?
No insulin, yes.
Okay, so Dr. Ari, this is where the interesting bit comes in. Let us know what exactly you use to reverse the diabetes.
So just as I said, with current scientific evidence, we've known that diabetes can be reversed. And having worked outside the country, I came across I went in thorough training regarding on how we could actually encompass this recent scientific evidence and actually try and translate it to patients. So we developed a program in Bermuda called Diabetic Reversal Program. And last year in January, I actually came back to Kenya to actually implement the same in Kenya. And this all the idea of reversing diabetes is based on the fact that we've known it to, as we've said, chronic disease. Yeah. We've managed it with medications, and with time, patients also go to insulin. And this, we've been doing this for a very long time. But then we have to step back and look, what if we just tell patients about lifestyle change? And that's all that we put my friend here, Isaac, on the same. It's a program that we designed, and we advise patients on lifestyle change, and actually they start getting off medications, they lose weight, and far much better than even reversal of diabetes. They feel much better and they are very energetic.
Okay, so Isaac, when they say lifestyle changes, what did you have to change in your life for you to actually see this drastic change?
One, the way I eat, because mostly I used to eat junk foods, like carbohydrates. You eat a lot of carbohydrates, but I didn't know that carbohydrates would cause diabetes. I used to like things like mandazi, mkate, chapati, such things. But since I met my doctor here, he taught me how to stop the diabetes or reduce diabetes. It started there.
So how exactly, what have you done? Have you done away with these foods or just in moderation?
Okay, you go reducing slowly by slowly. And eventually you come to a place where you, like for me, when I eat ugali, there is a lot of cabbages there. There's meat and a very, like meat, no, ugali. It's like, let's say, a matchbox size.
Okay, matchbox?
Like, matchbox size, that's
really?
what I eat, yeah.
Enough for a guy?
Enough for me, yeah. Yes.
Okay, and what's the rationale here? Carbohydrates seem to be the biggest, I don't know, attackers in as far as when the insulin is concerned. So in this case, are you saying if you do away with the carbohydrates, this metamorphosis could happen?
Yeah, the theory, we've always known that carbohydrates, regardless of what carbohydrate you take, actually all of them are converted to sugar. And this is a patient who is actually having a problem managing sugars. So if you were to advise these patients to reduce or even to some extent stop some of these carbohydrates, then you will be actually be dealing with the main problem, as opposed to you waiting for the sugars to raise and then you give these patients drugs to try and keep the sugars down. So the only logical thing you want to do in this case is to make sure that the sugars don't go up in the first place. And that's just by avoiding the carbohydrates.
Okay, so being overweight or obese is the biggest risk factor for type 2 diabetes.
Correct.
And especially the midsection, the girth, both female and male. I think this has been proven. Why are you a bit heavier than you are right now?
Woo!
Yeah?
Before I met Dr. Katambo, I was 97 kgs.
Wow, and what are you now?
I'm 76 now.
Impressive. And this has happened in a duration of how long?
In a near time.
In a year's time.
Yeah.
Okay, so apart from the food,
Yes.
did you have to engage physical exercises?
Not necessarily exercise, but I'm active. I don't just sit down idle like that. I'm always walking and doing something like walking. It's also part of exercise. Yes.
Okay, type 2 diabetes can actually be acquired, and that's why we say it is preventable. That's why we're talking about sedentary lifestyle, our foods, and what have you contribute to the same. So how best should you combine the food and the lifestyle change?
Oh, well, Gladys, it's very important for you to know what proportions of the two things that you've just mentioned to me contribute to type 2 diabetes. For example, if I told you diet contributes almost 80 to 85% of your diabetes, and 15% to 20% is actually contributed by inactivity. So if you were to pay attention to what will actually help you or reverse your diabetes, then I think the best thing to focus here is your lifestyle, which will be in form of diet. I'm not saying that physical activity or exercise is bad. When you combine them, definitely you get 100%. But if you can do with 80 to 85%, then good.
Okay. All right. So they say men normally have the biggest issue when it comes to discipline.
Yes.
Of that diet. Yeah, you want to see a lot of the meat, you want to see a lot of the ugali, but now to hear that you do a matchbox size is very impressive. Was it a struggle to discipline yourself to reduce to that amount?
Yeah, at some stages, yes. But I came to realize, because after in every duration of 3 months, he used to call me to come and do the shake-ups. And in every shake-up, my condition was going well. So I was forced to do that.
Okay.
Yeah.
And what is Mama saying at this point? She's cooking less food or serving you less food and wondering what's going on.
Okay, for now she understands. But in the beginning, it was like, oh, you don't want to eat at home. But I convinced her that she agreed.
It's not that you don't like her food.
No.
You're trying to watch your life.
Yeah.
Okay.
Yes.
So, in as far as the success rate is concerned, between men and women, where have you seen it apply more?
Well, I think it's in equal measures. Of course, scientifically speaking, men tend to lose weight faster than women. But according to the research we are seeing, I think it's in equal measures. Once you just change your lifestyle and focus in it, keep being consistent, then I think it's possible to achieve diabetes, type 2 diabetes remission.
Because most would say maybe the hormonal imbalances that women have to go through, they probably have to work a bit more harder. Is it true?
I wouldn't really blame the hormonal imbalance in this case, because the contribution to hormonal imbalance could be less than 1%. And as I said, that contributes to almost 80 to 85%. So if you're just consistent and keep to it, I think that's something you can achieve. Because sometimes even ladies, sometimes we tend to kind of like say, because I'm on maybe oral contraceptives, or I'm on this type of family planning or hormonal imbalance. But to be honest with you, once you just change your lifestyle, you will see great success. You will see outcomes.
Isaac,
Yes.
you say you're no longer taking medication.
No.
You were on insulin, right?
No.
What were you on?
I didn't go in the stage of insulin. I was on medication. In fact, I used to take like 6 tablets in a day.
Okay.
Yeah.
And these were to help with what exactly?
There was that one for diabetes and blood pressure.
Aha, because
Yes.
those two walk hand in
They
hand.
work hand in hand. Yes.
And now you're off the medication completely?
Completely.
Okay. Daktari, what informs this? Because most health specialists have been very critical about handling diabetes in such a manner where you pull the patient off medication.
It's true. Most, for example, if I use his case, when I saw him in January last year, he was on several pills, I think 5 to 6 pills. And these pills were diabetic medication, blood pressure medication, cholesterol medication, and I think he was also on aspirin. Can't remember the others. But what you need to know is that increase in weight or obesity actually has been associated with all these 3 diseases. You talked about obesity, which leads you to type 2 diabetes. It also makes you prone to hypertension and also makes you prone to cholesterol issues. So if you were to just reduce your weight, and in this case, we actually scientifically, we know that if you reduce 10 to 15% of your body weight, then you're able to reverse almost all those 3 conditions. And that's exactly what happened with Isaac.
So how long did you say it took for you to see a complete reversal?
It's a year.
It's been a year.
Yeah.
When did you start seeing the changes body-wise, physically?
In like 4 months there.
Really?
Yeah.
And this just was diet
On a diet.
and making sure that you're more active?
Yes.
Okay. How long does it take to reverse diabetes? Is it patient to patient?
It's actually dependent on a patient. But speaking of which, we actually have measures of saying, are you in remission or are you not in remission? So for him, he actually achieved remission at six months. And then after that, you have to follow a patient for another 6 months for you to make sure that they are no longer creeping to the same lifestyle. And that's what actually happened to him. He might not remember, but what happened actually is when he came, one of the first immediate thing you start seeing is the loss of fatigue, feeling well, because when your sugars are really high, you feel clogged up, you're fatigued, you don't sleep well, and these changes, you actually see them within the first 1 to 2 weeks. And then after that, the patient starts to lose weight slowly. Remember, you don't want to achieve weight loss quickly because you are not able to maintain. So if you're able to maintain 1 to 2 kilos in a month, then you will see results, consistent results.
Okay. And Isaac, you said you were dealing with hypertension, cholesterol. How are those now?
They're okay.
You are good now.
I'm good to go.
Absolutely.
Absolutely.
So when your colleagues or your peers, and I'm talking about the men in this case, are asking you, ulifanya nini, what do you say?
You know, some pity me, maybe think I'm sick.
Oh, because you lost the weight?
Because I lost weight. Something, what's happening to you?
Yeah.
But after I tell them, some would agree, others would argue. But all the same, I'm good.
Okay, which calls for a lot of awareness in as far as how diabetes actually occurs, type 1, type 2, and even the gestational one, Dr. Ari, right?
Yes. Yes, we really need to create a lot of awareness, and especially when it comes to culturally, as he said, he will meet his peers that are telling him, what's happening to you? Are you suffering from a certain disease? What's wrong? Are you not feeding well? And do you have probably, and especially in our environment, we tend to associate it with either HIV or cancer. And in this case, actually, one of the things that we do in the program is to prepare patients that this will actually occur, and you need to be aware that you are actually now starting to live a healthier life as opposed to an unhealthy life, which you are so used to and calling it a healthy life.
Okay,
yes.
We might be talking about, or we are talking about diabetes reversal, and it sounds like such good news, but should we say we should tread carefully when we say do not use your medication anymore?
Yes, we should, because you really need to have a healthcare professional who really understands what reversal and remission is. So I would really urge, before you change or change your lifestyle, to start taking either low carb and increasing your protein intake or your fat intake. It's always good to seek a healthcare professional advice, because there are medications that you really actually stop on the day that you actually start that type of lifestyle.
So in this case, if somebody has been living with diabetes, but they seem to be feeling much better now that they have adjusted on their own their lifestyle and they're more active, do they let go of a medication, or should they seek advice before they let go?
You have to seek medical advice. There's no shortcut to it. You have to seek medical advice, because there are parameters that we have to look at. Why in the initial case did you have to start medications? And if you've made the appropriate lifestyle change, then you go back to the healthcare profession to see, is it appropriate for you to stop medications?
Okay, so Isaac, they say men have the poorest health care seeking behaviors. Hampendi daktari, don't like the hospital. How has that been for you, and how has now this changed your perception in as far as your health is concerned?
Oh, it has changed. Because when I look at myself and the way I feel, I'm so energetic. You see? Like many people, I have colleagues there, and I tell them about it, but some just ignore. Yeah, like you said, men don't like going to hospitals and stuff like that. It's true. But when it comes to diabetes, you know, it disturbs you. You are not at peace. So you're forced to seek medical advice. And for good, I met Dr. Katambo.
Okay. Yes. And what is the role of alcohol intake? Because that has also been said to influence a lot of type 2 diabetes.
Oh, the doctor, the first thing I did when I came to the doctor, that's the question he asked me. Do you take beer? Unfortunately, I don't take. I told him no. So I wouldn't say anything about beer. Yeah.
So alcohol was never an issue?
It was never an issue to me.
Okay.
Yes.
All right. So, Dr. Ari, do you say stop the alcohol or do it in moderation?
Well, I don't want to get into that Pandora, but alcohol, generally speaking, is actually works against you when you have type 2 diabetes. Because if you take excess alcohol, what tends to happen, it deposits a lot of fat in your liver, and this causes fatty liver, which actually is a predisposing factor to type 2 diabetes. So you want to avoid alcohol.
Okay. All right, Dr. Ari. So does the veracity of a diabetes to an extent determine whether or not you can reverse diabetes for a patient?
The variety, sorry?
The veracity of the diabetes, does it now inform if the patient is actually a good candidate for reversal?
Oh yes, because many factors we put together. For example, age, advanced conditions like, chronic kidney disease or patient is in dialysis, and also the willpower of the patient to make a little bit of change. So it's very important for you to know which patient is going to make a little bit of change. So you set common goals that you can always achieve, both of you, because it's something that a patient has been doing for the last 10, 15, 20 years. So it will take a journey for you to work with your patient.
So Isaac, you're a new man today. What would you like to tell fellow men and those living with diabetes?
I would advise them not to, first, to stop taking beer. Or if you take beer, reduce the
Moderation.
Moderation. Yeah. Then you need to shake your body. You need to go to the doctor, know how your body is behaving. You might be having diabetes, but you don't know.
Yeah.
Because for me, when I went to the doctor, I was diagnosed and I was told I had diabetic for the last 1 year, but I didn't know.
Oh, wow.
Yes. So it's always good to seek medical advice. Yes.
Okay, Daktari, definitely this is still a new phenomenon, but it's pretty welcome, especially for those who would love to live a healthier life. What is your point of note? Because I know there are very many things that you need to put into consideration before you can go down this path.
My point of note is, first of all, and thank you to such programs to create awareness. As he has pointed out, right now we know the national prevalence is like 3.3%, with 44% be actually working with that diabetes and not knowing. So we really need to create awareness. Two, my message is, if you have type 2 diabetes, there is hope. We used to know that it's a chronic condition, that once you have it, you're going to be on medication, you're going to keep on adding medication, and eventually you get into insulin. It doesn't have to be the case. We have to be hopeful, and I know if you follow up to the right lifestyle change, you can actually reverse your condition.
Exactly. All right. Dr. Daniel Katambo, physician, and of course, Isaac Macharia, who is a post-diabetes patient. That is actually That is actually really good news. And thank you for having this conversation and educating us on the possibility of reversing diabetes. For more information, definitely you can reach us on or Twitter, that is at NTV Kenya, at Gladys_Gashanja, for all your questions. Time now for me to bid you farewell, but we shall see you at 1 p.m. with the day top stories, and NTV Sasa will be coming your way from 11 o'clock. See you then.